The new Omicron variants are hitting Salina and we're seeing increasing numbers. I'm Rob Freelove, Chief Medical Officer and Senior Vice President at Salina Regional Health Center.
Dr. Freelove, thank you so much for coming on to give us a COVID update. So where are we at right now with the numbers?
Well, unfortunately, we're seeing a rise in the numbers. The infection rate in the community and transmission rate in the community is really quite high right now. We've seen a lot more positive patients testing positive, and we've had an increase in our hospitalizations. We were running less than 5 for a long time, and then we kind of creeped into that 5 to 10 range a week or two ago, and today we're in double digits now for a couple of 3 days in a row. We're kind of in that 10 to 15 range, so seeing a little bit of an increase in hospitalizations. The good news is we're not seeing a lot of real severe illness. There are people who maybe have other conditions that those are worsening, and that's what's bringing them to the hospital, and they happen to have COVID, which might be contributing to that. But we haven't seen a lot of real severe illness, and really a few deaths so far.
When you're out and about or around in the hospital or out in the public, what's probably some of the most common questions you get asked about COVID?
Yeah, probably the biggest one right now is, why are we still taking all the precaution measures at the hospital? Why are we masking and limiting visitors and all that? And it's a really very simple answer. It's not over. It's not gone. It's still there. And in fact, right now, we're at a really high transmission rate. And we do all those things to keep our patients and our staff as safe as we possibly can when they're in our building.
If somebody does test positive at home, they take their test, how long or what is the process for them as far as quarantining?
So isolation, if you test positive now for the general public, is 5 days, and if you are if you're asymptomatic or if you're not running a fever anymore, symptoms are better, then you can come out of isolation after 5 days, but you're supposed to wear a mask continuously when you're out of the house. For healthcare workers, actually, isolation is still 10 days. They can't come back to work for 10 days.
Let's talk about vaccinations. What are your vaccination recommendations?
Well, I'm still recommending everybody get vaccinated.
Okay.
If you haven't gotten vaccinated, get your vaccine series started. If you have and you haven't gotten a booster and you're eligible for a booster, go get a booster. The new variants that we're seeing, the Omicron BA4 and 5, they are better at evading immunity, whether it be from vaccines or from previous infection. But the evidence still supports that people who are vaccinated and boosted have less severe illness, less likelihood of hospitalization, and a lower likelihood of death. And with the vaccine being more available for kids now, and school about to start, I would encourage parents, if they haven't gotten their kids vaccinated against COVID, they should. And if they're uncertain whether their child would qualify or not, they need to contact their physician and talk to them about that.
Thank you so much for some great information. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.